Hi everyone, Dr. Shervin here from Artistic Dental Studio with another dose of dental tips of the week, and today I'm going to talk about bad breath. This is a very important topic. We see patients with the same problem on a daily basis, and it could affect your life very immensely. Actually, it could affect one's self-confidence, also social encounters, and also even sex life. So what you will get after watching this video is that you will get an idea where it's coming from, and also what you will see is that how you can tackle this. Bad breath has different origins. So mainly it could come from oral cavity, or the source could be categorized as intraoral, and the second one is the extraoral origin. So let's begin with the intraoral one. The source of intraoral one actually is something that we need to be really careful about, because it could come from different sources. The first one is poor oral hygiene. If you don't do proper brushing and flossing and the teeth are covered with plaque or tartar, it could definitely cause some bad breath for you. The second thing is the gum disease. Bacteria lurking around your gums could cause gum inflammation, and because the gum disease is normally present in cases of plaque and tartar, this is a thing that we usually see in conjunction with poor oral hygiene. Also, gum disease causes some kind of pocketing, we say, around the teeth. So the gum around the teeth actually deepens a little bit, which could act as a niche for bacteria to lurk and grow inside those small pockets. And this even causes more bad breath and bad smell. The third thing are the gaps between the fillings and the tooth, or the crowns and the teeth, and also poorly formed crowns and fillings. This is another cause of bad breath, because those gaps or bad contours on the surfaces of the crowns or fillings could trap bacteria, and this in turn causes bad breath. The fourth one is furred tongue, something that we call in dentistry as furred tongue. This is something like there are some papilla on the tongue, and in some cases these papilla grow in size, they enlarge a little bit, and the spaces between the papilla is filled with food debris and also bacteria, and this could cause bad breath. So always brushing the top surface of the tongue is recommended to control this. Next one is cavities. Well, where there is a cavity, the tooth is decayed, obviously, and there are some bacteria involved, and it could cause some bad breath as well. The next one are some infected teeth. If there are any infected teeth present in mouth for any given reason, it could cause bad breath. Also, in cases of lack of saliva, in some people we see for any given reason, for example, some medications, some people are on some antihypertensive medications, like for blood pressure. This could affect the amount of salivary flow, and there is a kind of stagnation happening in mouth that could lead to a bad breath. And there are some mucosal diseases that could cause bad breath, and also the infection and inflammation of tonsils, which is called tonsillitis, is a source of bad breath in mouth. The next one actually is extraoral causes. We need to know where this is coming from. The first one is sinusitis. The sinuses are located on inside the top jaws. The mucosa covering inside the sinuses could easily get inflamed and infected, and after a while, because of the proximity to the oral cavity, it could cause some bad breath. The second one is otitis, or the infection of the middle ear. The middle ear has some connections with the throat, and if that area is infected, it could cause some bad breath as well. The third one are some gastrointestinal problems. Any problems with your stomach or with the guts, it could cause bad breath. And the next one is respiratory problems. Problems with lungs, with airways, could easily cause bad breath. The last one, or the last systemic cause of bad breath, are some systemic diseases like diabetes. Diabetes could cause bad breath. So as you can see, there are different reasons. So what could be done in these cases? First of all, you need to differentiate and know where it's coming from. So the best action to take is to go to a GP first of all, to rule out any systemic causes of bad breath. If the systemic causes are ruled out and you're under care of a dentist, then you need to go to the dentist, and what they will do, they basically run some tests, do a complete examinations, and also take some x-rays and just clarify everything. And if there is anything related to bad breath, they can definitely let you know what it is, and it could be controlled. So related to the topic of today, I'm gonna do a video next week about how you can do brushing and flossing. That's really important because, as I told you, the most important cause of bad breath in mouth is poor oral hygiene. Many people say we brush twice daily, but what they do is not correct. And in some cases, they ignore flossing, which is really important. So these two should be done in parallel. And the third thing that people may say could be a substitute for brushing and flossing is gargling with some kind of mouthwash. It is just complementary. So it could never replace the mechanical action of brushing and flossing. So next week, I'm gonna talk about this thing. I'm gonna let you know how you need to brush and floss correctly, and it just takes possibly, I would say, 5 minutes of your daily time, but it makes a big difference in terms of your oral health in general, and also helps you control bad breath. Thank you very much for paying attention to this video. Please share and like, and stay tuned for next week's video. Thank you so much, and enjoy your evening.